I was in the United Lounge, going to my mom's, you know, I have a pass. And in it was 3 robots taking bad dishes back. They were just moving along the United thing, in the lounge. That robot's name was Stevie.
They have a restaurant, but there's like a little robot.
Oh yeah, with sushi.
And they serve.
I was telling that the university, they have robots bring in instrument trays to the rooms all over the world. That's awesome. And case carts, it gets pulled. So then everybody has to put it in the same area, and the cart will like forklift it, and it just goes right in front of it. Or maybe a human loads it. What do you think? Human loads it. And then it just delivers it to the hospital. You know what I was thinking yesterday? I was thinking, man, I'm gonna have to be a chauffeur to Max when he starts going out with all these girls.
Oh yeah, you are.
But by then we'll have full self-driving cars. Yeah. So then I could just buy him an FSD and say, I could watch where the cars go. I've seen a few Waymos in town, actually. In San Antonio? Here? What? I know they have them in California. Twice. San Francisco, my buddy did. Went on when he was a few years before. Because he said that they were going around these like turns and shit. It's like a canyon. And he's just thinking, man, all these fucking things are going to go off the lid. Yeah. Now I saw it coming this way. You know, sure enough. Okay, nobody in it. I don't have rent. Wow, dude. And I was thinking, what is Max going to grow up? He's just going to get into a car we buy him that doesn't need a driver. Think about it. How their lives are different. Probably no more DUIs unless you're driving night. I don't know, man.
Good morning. Dr. J is just getting started. This lovely patient is having lipo 360 done, an arm lift, which is a brachioplasty, axillary and a breast lift. So we are actually showing this procedure on YouTube. So if you'd like to join us over there, you'll be able to see the surgery happening live. You can find it in our link tree, or you can type it in manually on the search bar at Dr. Jeneby Plastic Surgery. So Dr. J got started with some lipo 360 on her arms, around her axillas. Is going to get into this arm lift that extends into the axilla and that goes into the breast lift. If y'all have any questions, please leave them here. This patient is also having an add-on of Renuvion. Renuvion is an add-on that helps to tighten the skin in the areas where lipo was done. It helps to tighten the skin from the inside out.
What se perdió?
Again, we're going live on YouTube, so if you'd like to join us over there and see the surgery yourself, watch Dr. J live, see the procedures that this patient is having done, you can join us at Dr. Jeneby Plastic Surgery on YouTube. It's also linked there in our link tree. Let me know if you guys have any questions. I do have to warn y'all that any questions that are left here may be filtered out due to some words that will be flagged. So just a warning, if your comments or your questions are filtered. getting started on this patient's arm lift, so making that incision from the elbow, and is going to extend it down to the axillaris for the axillary brachioplasty. And then from there, we will flip the patient over and do her breast lift. So, like mentioned, Dr. J got started with some lipo, did some lipo on the patient's arms around the axillaris. This patient's having lipo 360 done, so Dr. Jeneby also did some liposuction around the patient's back, around her sides, just to give you guys an idea of what this patient's procedures are looking like right now. She's lying stomach down on the operating table. And Dr. Jeneby, like I mentioned, got started on some lipo. It's on her left side right now. Started with that incision that starts from the elbow down into the armpit where the axillaris are, is going to remove that excess fat and skin, and then stitch it back up to give it a nice, tight, smooth appearance. An brachioplasty or arm lift is recommended for those who have lost a lot of weight and have that saggy skin with the fat as well. And so that seems to be the case for this patient today. And then again, she's also having a breast reduction, which inadvertently is a lift. So it's going to lift her breasts and remove that sagging skin that she has there. This patient is also having an add-on called brachioplasty. Brachioplasty is a skin tightening procedure that is added on to patient surgeries for those who have had lipo done. So because this patient is having lipo 360, lipo done on the arms, around the axillaris, brachioplasty is going to be used in those areas to help tighten that skin from the inside out. What it does is it heats up and causes the skin on the inside to contract. And then on the outside, gives it a tighter looking appearance.
Spanish rapper? Really?
Again, good morning. Thank y'all for coming on and joining us. Dr. J has one case this morning, this wonderful Tuesday. This patient is having some lipo 360 done. She's having a brachioplasty, which is arm lift into the axillaris, so like from the armpit down to the side. And what that's going to look like is Dr. J basically removing that sagging skin. This patient is a weight loss patient. She's lost a lot of weight. And so because of that, her skin hasn't reduced back to the size of her arm. So there's just some sagging skin there. And of course some fat as well. So Dr. J is going to go in and surgically remove that. This patient is also having a breast reduction and lift. So reducing that sagging skin around the breast as well.
Oh yeah, it's the stomach.
It's the stomach lining.
Okay.
But
why would you call yourself that?
You got a point. You got a point.
Somebody made a grave mistake.
And then this patient is also having Renuvion done as well. So Renuvion is a skin tightening procedure for patients that have lipo done. Basically, this tool is inserted in those incisions where the lipo was done. It helps tighten the skin from the inside out. The results of Renuvion are amazing. Dr. J recommends it for almost every patient that has lipo done, just because the results of Renuvion are exceptional. Let me know if you guys have any questions about those procedures. If you're interested in having a quote, we have a new feature on our link tree, Build Your Bod. So essentially you can go on there and fill out that form and leave all of the areas that you want to have work done. So again, let me know if you guys have any questions about these procedures, the procedures that Dr. J offers, the procedures that you're interested in. If you're ready to move from the DMs to the OR, we can set that up for you. Love to get you in contact with our team. As you can see there on our YouTube, for those of y'all that are joining us over there, Dr. J is now starting to remove the excess fat and skin on this patient's arm and axillaris.
What they say now. We get it off the truck, you know, like in Goodfellas. They're like, tell the truck
And so we'll be live here for a little while. This patient, like I mentioned, 7 lipo 360 done, a brachioplasty, an axillary-plasty. She's having a breast reduction and Renuvion done all in one day, and you can too. Just leave a comment letting me know if you're interested. We can set you up with a phone call or an exchange with our team. And so right now, Dr. Jeneby is removing on the first side of the brachioplasty.
My baby. Like trying to say
so that is the part that has been removed from the patient's first arm.
Go on, girl. Go on, girl. How crazy is that movie, right? Tried to frame him, right? Yeah. Oh, goodness. That's a real cheese man. We can do it for the cheese man. Why don't we just get to work? You can't just do that. Oh, come on. Yeah, they do actually. How much is that? Is that another 7? Can we claim that better? We'll take it.
Might go bigger.
Again, thank y'all for coming on and joining us. Dr. J has one case this morning. This patient is having a axillary-plasty. So that is going to be an arm lift extended down to the axillaris. So Dr. J, what that looks like is Dr. J is going to make an incision going from the elbow down to the axillaris, down by the armpit on this side. Dr. J is going to remove some skin and fat. As you can see there, Dr. J is still on this patient's left side. is on the axilla part.
John famously now has his name in Boston.
This patient is also having a breast reduction and renewing on done today. If you guys have any questions about those procedures or any other services that Dr. J offers and specializes in, we'd love to answer those for you and just clarify what Dr. J offers. Also, if you're interested in a quote, it is free estimation. We can set that up for you as well. We have a form that you guys can fill out there on our profile. It is the Get a Quote form. Once you fill that out and submit it, someone from our team will reach back out to you.
Right on cue, he said, please take care. So for like 15 years, he's been telling us play PPC. Because I know it means something else. He said, no, it means please take care. I mean, we've been telling his wife teacher for like 15 years. You don't know? No. You never know. Then please take care. And when we finish DC, they call it DC, yes, we got. Sometimes his receipts come in as that dude incorporated, and sometimes CMO good. He splits it. That's okay. So really get charged tax. Oh, for franchise tax. Yeah, I know that's fine.
Hope you all are having a good morning. Again, Dr. J has one case today. This patient is having liposuction 60 done, brachial and axillary breast reduction, and lift, and renuvion. So Dr. J got started with some lipo 360. So what that looked like is this patient was lying on their stomach, face down on the operating table. Dr. J got started with just some lipo.
7.5 axilla doctors. Like the movie when
And the arms, Dr. J got started by making an incision from the patient's elbow going down to the armpit, down by the axilla, and surgically removed that sagging skin. This patient is a weight loss patient. She had lost a lot of weight prior to her surgery, and so a brachioplasty down to an axillary-plasty extended to the axillas is highly recommended for those who have lost a lot of weight. And so this patient is having that done today. So Dr. J has already removed part of the skin and fat from the patient's left side.
I want the commander's name put back to the red skin.
And then Dr. J will move on the right side, and then do the exact same thing.
He said that? Yeah, he's like, I want you to bring back the red skin. Which is true, like, that's their name. Kansas City Chiefs? Why do they? Right? I did. I asked. Oh, did you?
And so this will be our only case of the day. Dr. J's only case of the day, but Dr. J has another case tomorrow and a few more later this week. So we'll be live later this week, but this will be our only live for the day.
Ketchup and mustard. Oh, I like this radio station, though. I didn't know DJ had such wide soul, different genres.
Oh. As you can see there on our YouTube, Dr. J is doing some lipo and he has moved to the patient's right side. So earlier Dr. J was on the patient's left side. And essentially everything that was done on the left side, so removing the fat, the brachioplasty, the axillary is going to be done on the patient's right side. So as you can hear that kind of breathing, grinding noise, that is the cannula, the liposuction tool that Dr. J is using. And so what that does is just sections the fat in these designated areas. So right now Dr. J is doing some liposuction on this patient's arms and axillas there. As you can see on our YouTube, I can redirect y'all over there if you'd like to watch. Again, it's going to show some blood, some nudity, so keep that in mind. This patient has lost a lot of weight, and so with that, an axilla brachioplasty, so an arm length that is extended to the axillas is highly recommended because the results are wonderful. It helps remove those bat wings that people commonly refer to.
What's everything going to look like? I think AI has only had like 2 or 3% penetration. Not even that. Not even that. They were showing a Chinese factory that's all robotic now. And all these little robots scurrying around 24 hours a day, 7 days a week, pulling shit off the shelf. No complaining, no peppercorn, nope. Yesterday I pulled into my house and Ashley had come behind me about 2 hours later. Said, you need to come out and look at your Jeep. I'm like, what's wrong with the Jeep? 80% of my coolant is on the ground. All bright green. I'm like, oh, hose? Maybe a hose. Yeah, hose. So now I have to... The hose knows. The hose knows. I'm thinking about just getting a guy to come replace it.
Again, for those of you just joining us, thanks for being here. This patient is having lipo 360 done. So that is sectioning the fat around this patient's abdomen, her back, her sides. This patient is also having lipo done around her axillas, her arms. This patient is having a brachioplasty. What that is an arm lift extended down to the axillas, and then it's going to go into the breast reduction as well. So this patient is having a breast reduction, which inadvertently is going to give her a lift. And then this patient is also adding on Renuvion today. What that is a skin tightening procedure. It is used in the areas where lipo was done. It helps to, it heats up the skin from the inside out, causing it to contract. And then what it does is on the outside gives it a tighter appearance. Dr. J and some of our other surgeons that we work with will recommend Renuvion for patients who are having lipo for almost any case. It's recommended just because the results are exceptional. Let me know if you guys have any questions about that. Also, if y'all are interested in getting a quote for your procedures that you're interested in, we have a form here pinned on the bottom of your screen, or you can click our link tree and hit our get a quote form. It's free, takes about 1 minute. Someone from our team will reach back out to you and be able to give you an accurate quote, including all of the discounts that we have for the month of September. So definitely take advantage of that tool. Again, thank you all for joining us. This is Dr. J's first and only case of the day. She's having a lot done. This patient is having 360 brachioplasty, a breast reduction and lift, and venereal. So let me know if you guys have any questions. With this being Dr. J's first case of the day, we're going to be live here for a little while longer. We've been in here for about 30 minutes, about 25. So we'll be here for a little while longer. Dr. J has to flip this patient over, so we'll take a break at some point so that we can flip her over, and Dr. J will do her breast reduction and lift. But in the meantime, we'll be live until then. And again, this is our only, Dr. J's only case of the day. Later this week, we have some exciting cases. Dr. J has a rhinoplasty tomorrow, which is really exciting, and some more cases later this week. So tune in for those. Love to share those with y'all. Love to have y'all join us. Again, any questions, comments, you can leave them here. We'd love to give y'all a free little quote. All you have to do is fill out that form in our link tree or get a quote form, and we'll send you some information about those procedures that you're interested in, give you a phone call, email, a text, whatever your preference may be. And so as you can see there, Dr. Jeneby is on this patient's right side now, doing some lipo on this patient's axilla and around her arm as well. And then here in a moment, Dr. J will get started on the right side doing the arm lift into the axilla. So removing both the skin and the fat on the arm and the axilla.
Axilla.
Again, thank y'all for joining us this morning. Dr. Singh has this patient's case. This is his one and only case of the day. This patient is having lipo 360 done. She's having a brachioplasty, a breast reduction, and lift, and then venereal. So that is an arm lift that's extended down to the axillas. Hey Crystal, good morning, that's my Gia. We love this song too. How's your morning going so far?
I'm doing it. Just pulling the
And so this patient is, Dr. J has already removed the skin and the fat as part of the brachio and axilloplasty on the patient's right side.
Yeah.
Good. And
Or my fix it.
my morning is going excellent. It is it's early here at Chrysalis, but it is still a beautiful day. It's a little chilly this morning, but nonetheless a beautiful day regardless. Thanks for joining us, Crystal. Let me know if you have any questions. Love to answer those for you. Again, we're with Dr. J. He's having doing his first case, his only case of the day. Let me know if you have any questions, Miss Crystal. how'd you stumble upon our live, if you don't mind me asking? Just curious. Hey, Ariana, thank you. And we are also live on YouTube showing this patient's surgery. So everything that's happening for this patient, so her brachioplasty, breast reduction, renuvion, we're showing all of that on our YouTube. You'll be able to find it in our link tree, or you can type it in on the search bar on YouTube there. It's going to be Dr. Jeneby Plastic Surgery. And there you guys are able to see this patient's surgery, all the procedures that she's having done. Well, Miss Crystal, we're glad to have you. Thanks for joining us. Been a follower for a while. Yay! Yeah, Crystal, so we're located in San Antonio, Texas. Dr. J operates at Maximus Plastic Surgery Center and Chrysalis Cosmetic Surgery Center. Where are you located, Crystal?
Alexa, next song.
Is your surgery center near North Central Baptist? Miss AC, I am not.
Alexa, next song.
I'm not 100% sure. Are you in the San Antonio area,
Alexa,
Miss
play
AC?
Flock of Seagulls Radio.
That's not far from me. I'm in Arkansas. Yes, ma'am. That's not too far at all. Dr. J sees a lot of patients that are from out of state, all across Texas. So it's very frequent that we see patients coming very far distances to have their surgeries done with us, and we're very honored. We offer overnights here as well. So the night following your surgery, we will have you overnight just to make sure that everything is going well after your procedure, that your body's healing, that everything looks normal. So that is something that we offer. We can help you set up accommodations, help you set up some arrangements as well. All that starts with getting in contact with our team. Let me know if you'd like to start that process. If you're interested, we can provide you with a quote today. Again, this lovely patient is having a liposuction 360 done today. A brachioplasty, which is an arm lift that is extended into the axillas. This patient is also having a breast reduction and lift and renuvion today.
What do you think the team this year's up? Is going to go all the way?
Hard to tell.
If you had to make a prediction.
Billy has a good chance. They really didn't.
Why do they always have like I don't know. They always play like really good and are up there. These players coaching
Everything, man, right? He's a
or
good
they're
player. So keep paying negative stars, right?
Yeah.
And their salary cap gets whittled away, and then they get their stars.
Yeah, let me know if y'all have any questions. This lovely patient is having lipo 360 done today, brachioplasty, which is an arm lift that is extended down to the axillas. So this area here from your armpit down on your side. This patient is also having a breast reduction and lift with renuvion.
where do they give them up? Too much money?
That's the problem is they don't honor their contract. Another year. Rookie. So you're holding out, like, do that and not honor our contract. How do you not honor our contract? How do you get to do that?
How to get away with that?
You're like, how's that happen?
doing excellent. Got any exciting plans for today or this week? Just to give you an idea of what's happening right here in the OR with Dr. J. This patient is having lipo 360 done, brachio and brachioplasty, breast reduction with the left, and Renuvion. Taking care of my baby. Aww. Yeah, go ahead, Sydney. What question do you have? You can leave it here, or you can reach out to us by the number that's linked there in our bio. Yeah, that's a great question. Hey, Dr. J.
Hey.
So this person comments, her baby is 3 months old. How long does she have to wait to get surgery?
Depends on what the surgery is, and if she has help at home. If it's breast surgery, everything, all the milk areas have to be dry. Like, she has to finish breastfeeding, and then it takes about 6 weeks most of the time to dry up.
Okay.
If it's like tummy tuck or lipo, we could see her and then plan something around 6 months to 1 year.
C-section? Delivery.
Yeah, she have a C-section, vaginal delivery.
So Sydney, I don't know if you're hearing any of this. Did you have a C-section or a delivery? Dr. J mentioned that depending on what surgery you're interested in having done is also going to depend on how long you'd have to wait. So she said natural delivery.
When does she want to have it? She can't, I mean, ASAP is not going to.
What type of surgery?
What type?
So
Like
Sydney,
body
what?
work or breast? Or both?
So Sydney, what procedures were you interested in having done? Did you want your breast done? Did you want like a tummy tuck, lipo? What were you interested in? Like I mentioned, Dr. J mentioned that it's going to depend greatly on what you want to have done, and from there they can determine like what would be an appropriate waiting period until you had that surgery. Also, Dr. J mentioned since you did just have a baby, the procedures that you have done, you're going to need to, depending on what you have done, you're going to need to have a lot of time to heal. And so with a newborn, a baby, unless you have help at home with the baby, you might want to wait a little bit longer. Unless you do have help at home. Because you don't want to be lifting the baby or having to carry too much. You'll want to wait a few weeks to a few months after surgery before doing that. So that's a setback as well. So what procedures, if you don't mind asking, were you interested in? Oh, I see. I'm really sorry, Sydney. If you want, you can go ahead and fill out our get a quote form. And after this live here, I'll go in and take that information. I'll take that information and submit it to our team. It's like get a quote form there on in our bio. A implant and a lift. So she's interested in an implant and a lift.
Yeah, that's good. You have to dry up all the milk. It has to be dried up. Any questions, John?
Yes, ma'am. So it's going to have to be completely drive before Dr. J could go in and do the breast implants and the lift. So yes, Miss Sydney, and we can provide you with more information, more detailed information specific to you and your case. If you start with filling out our getting quote form, so that way our team can get in contact with you and have a phone call. We can set up a consultation. Can I still BF if I want in the future or no? Can I still BF if I want in the future or no? Sydney, I'm not exactly sure what BF. Can I still BF if I want one in the future or no? I'm not exactly sure what that means. Oh, I gotcha. That's a great question. Hey, Dr. J.
Hey.
If she were to get implants and a lift done, could she still breastfeed in the future?
That's a great question. I'm supposed to verify it. Guys, man. You just compound beating. Like fat and give me an iris.
Yeah, side of it.
Iris.
It goes on here? On top of it. No, the top.
Something funny. You guys are funny.
Or I think I did, so I just scrapped it.
5 in, 5 extra left.
So, Dr. J, is that possible or
Sorry,
no?
what did you say?
Would she be able to breastfeed after having?
Oh, I'm supposed to quote her a 3% risk, but she's not.
Okay.
But point in fact, I've never really had anybody say they had trouble with both sides.
Okay. Gotcha. All right. So, Miss Sydney, if you heard that during the consultation process, he has to quote you for a 3% chance of you not being able to. But like Dr. J just mentioned, I don't know if you heard. He's never had any patient coming back having issues with breastfeeding after, but again, it is a concern, it is a possibility, so you need to be wary of that if you want to have, you know, lots of kids and that's what you want to do is breastfeed them. You may risk that chance of not being able to in the future, but again, it's very unlikely that that would happen. Yeah, Miss Sydney, these are all great questions.
I'm not sure what that is.
Yeah, Miss Sydney, so like we mentioned, we can provide you with more information specific to like you and your case by providing you with these quotes. So once you leave us with all of your information, we'll be able to get in contact with you, have a conversation over the phone, through text, set up a consultation, and from there we'll be able to basically give you more information specific to you.
So what, left or right?
And come up with a game plan for those procedures that you're interested in. So again, I can direct you to that inside getting quote form there pinned on the screen here or in our bio. And this patient is having brachio and axillary breast reduction with a lift, lipo 360, and renuvion done today. We are going to go ahead and take a break. Dr. J has already got started on the left side, already removed that skin and that fat, and is finishing up on the right side. And so we're going to take a break, and then we'll come back for the breast